Today I'm going to be talking about something very topical. Health insurance systems. Yay! So when I say topical in this context, I mean topical in the US. Most other countries have already figured this stuff out that I'm going to talk about today. So this video is mostly going to be for my fellow Americans out there. Everyone else, feel free to stick around and maybe you'll still learn something interesting. I want to note that there are moral and rights-based arguments on this topic, but I, perhaps unsurprisingly, am going to be focusing exclusively on the economic side of it. Now, this is a topic that can be approached from many different directions, many different angles, and today I'm going to be discussing what insurance is, what makes health insurance special, and what are the most important things to get right about health insurance if you care about improving the economy. I might make another video later to talk about the differences between different systems in different countries, but let's just get this part done first. Insurance is a pretty simple idea. So basically there's something that you may or may not have to pay for at some point, something that's both potentially expensive and unpredictable by its very nature. If you're a financially responsible person, you might try to put some money aside over time just in case you have a rainy day type of situation. The problem is that you don't know when that day will come, how much it will cost, or how many of those days you'll have in a short amount of time. Even if you were an expert in statistics and could make pretty good predictions about these things, and even if you earned enough money to save enough money over a long enough period of time, it's still entirely possible that you're just not capable of saving enough money fast enough. That's exactly the problem that insurance is intended to solve. In a way, insurance is a better system for people to come together and save the money that they need for those rainy days. Instead of putting aside money yourself, you pay an insurance provider who has the knowledge and the statistical expertise to do research and determine the average cost of your rainy days over a long period of time. But they still don't know when your rainy days will be, so in order for them to have enough money when the time comes, they do this for a large number of people, and they keep it all together in the same fund. Since it's very highly unlikely that everyone will have a rainy day at the same time, it works out pretty well, especially with larger numbers of people. As an economics nerd, I think insurance is a really cool solution to an interesting problem that disproportionately affects lower income people who have less ability to save. It smooths consumption. That is to say, it makes your financial life more stable and predictable by getting rid of the big nasty spikes in the amounts of money that you have to spend each month. However, the concept isn't a perfect solution. For the wealthy, who can save a lot already, it does practically nothing. For the middle-income people, well, that's where it tends to work the best. But with the kinds of rainy days where the average cost doesn't change much from person to person, some poor people may be unable to save even that average monthly cost and thus can't pay for insurance, which leaves them still with those big nasty spikes. And they're already exactly the people for whom the big nasty spikes are the biggest problem. There are many different kinds of insurance, but health insurance is a little bit special. It's because, first off, everybody needs it. Right? Not everyone owns a car, not everyone lives in an area that's prone to flooding, but everyone is at risk of getting sick or injured through no fault of their own. It's relatively uncommon, but the timing is totally unpredictable, and the costs can be utterly debilitating. Second, because everyone needs healthcare from time to time, and the costs don't really vary much between rich and poor people, the problems that health insurance specifically is meant to solve affect everyone in the economy with huge impacts for economic activity. If you watch my videos on government debt and on inequality, you'll get a basic understanding of why the consumption of poor people is important to pay attention to. The people whose consumption is most affected by healthcare costs are poor people, and that consumption drives local economies. Now, it's important to cover all necessary treatments, like the effective treatment of chronic conditions, for instance, but the greater economic problems arise from systematic underuse of routine health services. A major culprit is the underuse of preventative care, or health care that reduces the likelihood that you're going to have bigger problems in the future. Smart use of preventative care can reduce overall healthcare costs in the long run and improve outcomes. This is actually really quite well laid out in this Reuters article, even if the title seems to suggest something different. Basically, it's cheaper to try to stop someone from developing a big problem than it is to actually take care of the big problem once it develops. Spending less of our resources overall on healthcare would mean more spending on other types of things throughout the whole economy that could sustain more economic activity. What is totally undeniable is that using proper health services leads to longer and healthier lives. And this is important for the economy because a healthier worker is a better worker. Better workers can do more work and they can earn more money. The effects here can be staggeringly large in poorer countries where even seemingly minor improvements to health, like small improvements to nutrition, have been shown to have dramatic impacts on productivity. Like this study, which found that just providing dietary iron supplements to female cotton workers in Beijing improved their productivity by 17%. Let me just tell you, that's a huge number. But even in richer countries like the US, healthier people are still more productive at work, and healthier children do better in school, which makes them more likely to be successful throughout their lives. A lack of health insurance reduces the chances that people will make use of these kinds of health services. If it costs you money and you don't need it desperately right this very second, then you might just say screw it, even if you have enough money that you would be able to use it if you wanted. Insurance removes the cost at the point of use, that is, the cost that you have to pay when you decide to use the services. It moves that cost elsewhere to your monthly premium. This makes it more likely that people will actually use the recommended healthcare services. But there's still a problem of people who can't even afford to pay the cost of an insurance premium. And even with insurance, a system that involves high cost sharing through co-pays and deductibles, like the system in the US, doesn't actually solve the underuse problem, because people still have to pay high costs out of pocket at the point of use. So how do you set up an effective and efficient health insurance system? First off, you need to have one that eliminates out-of-pocket costs as much as possible. Although going all the way to zero isn't always necessarily ideal. For instance, the German system has some small copays for prescription medication that actually increase with the price of the drug. This creates incentives for people to actually choose to use cheaper generic drugs that are just as good instead of using the more expensive brand name drugs. Generally speaking, however, you don't want people to choose not to get treatment just because they're afraid of the costs. This only reduces the long-term health of the person, and if we're talking about an infectious type of situation, it puts more people at risk, and this increases the long-term cost of the healthcare system overall. The other thing that you need to do is figure out a way to make sure that even the poor people who can't afford it are still covered. Those poor people are workers, after all, and their children will one day be workers as well, so their health is every bit as important to the economy as the health of a rich person. What's more, bad health makes you less productive, as we already said, and can even make you unable to work, which reduces your income. And lower income reduces your ability to maintain your health, so a poor person is far more likely to get sucked into a vicious cycle of worsening health and worsening poverty. Even if we have some systems to take care of these people, as unfortunate as they are, and of course we should have such systems, it's still better for the economy if we can make sure that they remain healthy and productive members of society. It costs society more to support someone through welfare than it does to prevent them from ever needing that welfare assistance in the first place. This is where the government needs to step in. Broadly speaking, the average costs of healthcare don't change much from person to person, but the economy is better off when everyone receives the healthcare that they need without breaking the bank. The advantage that the government has is that they can do something which a private company can't. They can cross-subsidize. And that's just a fancy term which means making richer people pay a higher price than poorer people. This is literally the only way to make sure that the poorest people are still covered. And every country with public healthcare does this. Even the US already does it to a certain extent with Medicare and Medicaid, which are paid for by taxes, which are higher for wealthier people. It's not such a leap of logic to go from that to a system like the one in the UK, where everyone's healthcare is paid for by taxes. Or like the system in Germany, where people pay an insurance premium, but those premiums are fixed at a certain percentage of your income. And the fact is that the government in the US already pays for healthcare for the poor and lower middle class people, but in the most expensive way possible. It pays for their emergency room visits when they have no choice but to go to the hospital and they still can't afford to pay their bills. That leaves you with two choices. Either you simply don't let poor people go to hospitals ever for any reason, I'll let you mull over the ethical implications of that, or you have the government take care of their routine health care. Anything else and all you're doing is wasting resources. Now, assuming that you accept the economic importance of insuring every single person, the only remaining argument against a public health insurance system is one which claims that a private system is more efficient. But it's not at all clear that this is the case. All other countries of comparable wealth to the United States have public systems, and plenty of work has been done to compare them. First, the cost issue is often discussed, and I don't want to waste our time on such a settled issue, so I'll just say that yes, the US system is far more expensive per person. In terms of the quality of the actual medical services and procedures provided to patients, the US is better at some things and worse at others, but there's no real clear connection here to the public versus private debate. Overall measures are far more interesting. The US has more premature deaths, more deaths from preventable diseases, and more people with disabilities than other comparable countries do. These outcomes are more closely related to not only the existence of the uninsured, but also the underuse and underprovision of healthcare that is inherent to a system with high costs at the point of use. The big one that defenders of the American private system like to bring up is the argument that socialized healthcare means longer wait times. But the fact is that the US doesn't even have particularly low wait times as is compared to similar countries. People often point to Canada as an example of worse wait times, and yes, they do have worse wait times, but Canada is the exception rather than the rule. The issue of wait times is more a matter of investment in healthcare infrastructure than any kind of difference between public versus private insurance. It's about how many hospitals there are and how many doctors and specialists there are per person, and that needs to be addressed by government intervention anyway, because hospitals are inherently monopolistic in the sense that most people don't have the luxury of shopping around for different hospitals. You just go to whichever one is closest or whichever one your insurance provider says you're allowed to go to. Thus, they have sort of a captive customer base and don't really have to worry about competition. If you watched my video on market failures, you may remember that monopolies in a free market will tend to provide less of their product than people want to buy and at a higher price, which requires government intervention to correct. So rather than a laissez-faire free market policy, the solution to reducing wait times is actually government intervention to ensure sufficient investment in healthcare infrastructure. The UK, which has better access to same-day and next-day appointments than the US does, no matter what else you might have heard, solves this by creating a government-managed national monopoly on hospitals. There are some problems and risks that go with doing it that way, however. When the government has total control over all healthcare costs, payments, and funding, it leaves the industry open to political manipulation, where politicians may face pressure to reduce spending at every opportunity, harming the effectiveness of the system as a whole. But there are many other ways to achieve those same goals while insulating the system from the winds of politics. For instance, government could offer financial incentives for health infrastructure investment in underserved areas with excessive wait times. Another practice that would help is to unify negotiations between payers, that is, insurance funds, and healthcare providers, so that all doctors and all insurance funds will accept one another, which would reduce the bottlenecking effect where many patients are trying to see the same doctors and specialists instead of others that may be more available. As I often say, the most important thing is to design a system with the right incentives. As a part of this, it's also supremely important to have a robust structure for management and administration of the industry where all stakeholders, that is doctors, hospitals, insurance funds, and patients, can take part in the decision-making process and be heard. This prevents any one actor from taking an unfair advantage over any other. I'm not prepared, especially not in this video, to make any specific claim about what the best system would look like, but I can point to examples where certain things work better. But we'll save that for next time. For now, thanks for watching.